The Fones technique is used primarily for children. It's also used for the patient that doesn't have the dexterity to use Bass or modified Bass technique. The toothbrush is taken and just used in a circular motion with the upper and lower teeth together. We go all the way around the buccal areas, the labial areas, both upper and lower together at the same time. For the linguals, we're going to do the same thing, just a circular motion. We'd have to do upper and lower separately. Again, in the anterior region, we're going to do the heel to toe motion. This again is for the patient that is lacking dexterity. For a child, once they have the dexterity to use Bass or modified Bass, we'll move them into that. We're going to review the brushing technique, Bass. The technique that we actually use is modified Bass. This technique is used for the patient that does not have recession. The toothbrush is placed at a 45-degree angle into the sulcus. The patient will then wiggle the toothbrush 3 to 5 times and roll down. The Bass is placing the toothbrush at a 45-degree angle into the sulcus. The modified is the roll down. So we use a modified Bass. 45-degree angle into the tissue, into the sulcus, and roll down. The amount of brushing that is required in an area is determined by the amount of plaque that is on the teeth that we need to remove. We want to overlap as we move around the mouth to ensure that we're getting every area and not missing. We're going to do the same motion on all the labial and buccal areas. Also the lingual, the exact same motion is used. The lingual anteriors, we're going to use a heel to toe motion. They were going up and down to clean the linguals, lower and upper. We use this motion rather than the modified Bass because often a toothbrush is very difficult to fit into these anterior areas. The brushing technique, modified Stillmans or Stillmans, is very similar to the Bass technique or modified Bass. The angulation of the toothbrush is basically the same. It's the placement that is different. Modified Stillmans is used for the patient with recession. We will take the toothbrush, place it at a 45-degree angle on the tissue, as opposed to Bass that it was in the sulcus. So we take a 45-degree angle onto the tissue, wiggle 3 to 5 times, and roll down. We again are going to overlap, making sure that we get every area. We're going to do this on every area: labial, buccal, and lingual. The anterior linguals, we're going to do exactly the same as we did with Bass, that it's a heel-toe motion. To keep things simple for our patient, we're not going to complicate it and say that they only do Stillmans in recessed areas and Bass in the other areas. To keep it consistent for our patient, if our patient has any recessed areas, we're going to use modified Stillmans. This will stimulate blood flow and help with healthy tissues for the patient with recession. The Charter's brushing technique is used primarily on the ortho patient. A patient that has full mouth bracketing has to be able to clean the bacteria off of the brackets. The toothbrush is placed towards the incisal edge, and the patient will wiggle and clean any debris, plaque, and bacteria from around the brackets. This is done labial and buccal areas all the way around the mouth. This technique is also used for the patient with a bridge. If there's a bridge, we're going to use the same technique above the pontic area. We want to be able to clean underneath the pontic, so we're going to use the same Charter's motion. A patient that has a crown would use either the modified Bass or modified Stillman, depending on the condition of the tissues. The crown should not have a margin that would require any type of Charter's brushing. The lingual areas, you would use also modified Bass or modified Stillmans, depending on the tissue condition. To clean underneath the brackets, when you're cleaning the occlusal edges, doing the scrubbing motion on the occlusals, the toothbrush bristles would actually come up around the areas to get underneath the brackets. So underneath the brackets is just cleaned while we're doing the occlusal areas, maxillary and mandibular. The technique that we use for occlusal surfaces with any of the techniques, modified Stillman, modified Bass, Charters, or Fones, is simply a scrubbing motion across the occlusal surfaces. This cleans out all pits and fissures in the areas on the occlusal surface, maxillary and mandibular.